Hey everyone, welcome back to the channel. Today, we are diving into a topic that affects millions of men worldwide: prostate cancer. It's one of the most common cancers in men, with 1 in 8 men diagnosed during their lifetime. But here's the thing: early detection and treatment can be life-saving. So, we're going to break down the case of Rodney, a 76-year-old gentleman diagnosed with prostate adenocarcinoma. We will explore his diagnosis, treatment plan, and what the science says about his prognosis. Stick around, because this is information you don't want to miss. First, let's talk numbers. Prostate cancer is the second most common cancer in men globally, with over 1.4 million new cases diagnosed every year. For men over 70, like Rodney, the risk increases significantly. In fact, studies show that nearly 60% of prostate cancer cases are diagnosed in men aged 65 or older. Rodney's diagnosis: prostate adenocarcinoma, classified as T3A-N0, M0, with a Gleason score of 3+4 and a PSA level of 5.3 nanogram per milliliter. But what does all that mean? Let's break it down. Okay, let's start with the staging. The T3A means the tumor has grown just outside the prostate but hasn't reached the seminal vesicles. N0 means no lymph node involvement, and M0 means there's no distant metastasis, so no spread to bones or other organs. That's good news. Now, the Gleason score. Rodney's is 3+4, which adds up to 7. This indicates moderately aggressive cancer. A study published in the Journal of Urology found that men with a Gleason score of 7 have a 10-year survival rate of around 80 to 90% with treatment. Finally, his PSA level is 5.3 nanogram per milliliter, which is relatively low. For context, PSA levels above 10 nanogram per milliliter are associated with a higher risk of aggressive cancer. Rodney's MRI revealed a lesion on the left side of his prostate, almost reaching the apex. Importantly, there was no convincing invasion of the seminal vesicles and no spread to the lymph nodes or bones. This is crucial because metastasis dramatically reduces treatment options. According to a 2020 study in Cancer Research, the 5-year survival rate for localized prostate cancer is nearly 100%, but it drops to 30% if the cancer has metastasized. So, catching it early is key. So, what's the plan for Rodney? His doctors started him on androgen deprivation therapy, or ADT, in December 2024. ADT works by lowering testosterone levels, which fuels prostate cancer growth. Research from the New England Journal of Medicine shows that combining ADT with radiotherapy can reduce the risk of cancer progression by up to 50%. Rodney will also undergo radical radiotherapy, 60 gray in 20 fractions over 4 weeks, starting in March or April 2025. Studies have shown that radiotherapy reduces the risk of prostate cancer mortality by nearly 50% compared to active surveillance. But like any treatment, it comes with side effects, such as fatigue, urinary frequency, and potential bowel issues. Now, let's talk survival rates. The NHS Prostate Predict tool estimates that Rodney has an 8% chance of dying from prostate cancer within 10 years if left untreated. With radiotherapy, that risk drops significantly. However, it's important to note that many men with prostate cancer die from other causes. In Rodney's case, he also has a 3.3 centimeters abdominal aortic aneurysm, which needs monitoring. A 2019 study in The Lancet highlighted that managing comorbidities is critical in older patients with prostate cancer, as they can impact overall survival. Rodney's lifestyle choices are also worth discussing. He's an active guy. He enjoys dancing, hitting the gym, and even Pilates. He used to drink half a bottle of wine a day, but has cut back significantly. And here's why that matters. A 2021 study in BMC Cancer found that excessive alcohol consumption can increase prostate cancer risk by up to 20%. Rodney also quit smoking in 1988, another smart move, as smoking is linked to worse prostate cancer outcomes. A study in JAMA Oncology found that smokers with prostate cancer have a 61% higher risk of dying from the disease compared to non-smokers. Rodney and his doctor discussed active surveillance, a strategy that involves regular PSA testing and scans instead of immediate treatment. While this approach works well for low-risk cancers, Rodney's cancer is already at moderate risk, which is why he opted for radiotherapy. A 2022 study in European Urology found that men with intermediate-risk prostate cancer who chose active surveillance had a 50% higher risk of cancer progression compared to those who underwent treatment. So, what's next for Rodney? His radiotherapy starts soon, and we'll be keeping a close eye on his progress. His story highlights the importance of regular screenings, knowing your risk, and making informed treatment decisions. If you or a loved one are facing similar concerns, talk to your doctor and stay proactive. And remember, early detection saves lives. If you found this video helpful, don't forget to like, share, and subscribe for more evidence-based health content. Drop your questions in the comments, and let's keep this conversation going. Stay healthy, stay informed, and we'll see you in the next video.